To Cameroon now, where for years Dr. George Bwelle has been commuting to remote villages in Cameroon on weekends, providing critical health care free of charge to poor communities. DW's Blaise Eyong recently accompanied Bwelle and his team of volunteers on a two-day trip from the capital, Yaounde, to Mokolo, near the Cameroon-Nigerian border. Be aware that the next report contains real images of medical procedures. Do consider looking away if you're sensitive about surgery.
My name is George Bwelle. I'm a Cameroonian visceral surgeon working in Yaounde Central Hospital. We are an association of volunteers named ASCOVIM.
This is the director. Oh, okay.
A group of young people and some retired doctors. We mix and we create a team who leave Yaounde every weekend and set up a mobile hospital in a village. During these 2 days of treatment, we receive all the population of the underprivileged people of the village and give them free health services. Our goal is 200 surgery, so we are still waiting patients coming all over the villages. And you know, even if after, when you do the 200, you have another one, 201, 202, 203, and there are patients who are going to miss this because some of them are in their farm now, far from here, and they don't know about the program. My father was ill for 23 years. He was having a blood inside the brain. There were only one neurosurgeon in Bwelle, and it wasn't easy to meet him. So we were like 200 or 300 people waiting for that neurosurgeon, and my dad told me, when you graduate, I know your aim is to be a doctor. When you graduate, be a specialist and take care of the people who don't have means to meet the specialist. That's why we created ASCOVIM, not to stay in the hospital waiting patient, but to go beyond the all kind of places to meet the patients on their places and to treat them there.
C'est une maladie grave que dans notre famille même, ça nous a dépassé. On ne sait quoi faire avec sa maladie-là. Dans notre famille, la maladie-là ne s'est jamais passée.
This kind of patient, without this kind of occasion, without this kind of opportunity, they stay with their illness and those illness grow. That's why sometimes you can see a patient with the hernia. The patient has 44 years and the hernia also 44 years because he was born with it. And without means to take care, you have this kind of huge patient, huge pathology.
Pour mon malade, je ne sais comment remercier d'abord l'équipe de la campagne, l'équipe technique de la campagne. Je rends grâce à l'Éternel pour tous ses bienfaits.
In the rural area, with the poverty, they want to go to the hospital, but they don't have money to buy their medication or to come in the hospital, so they stay for long with their illness. So the main thing you will see is that you will see the illness, but you will see it at a last stage. 8 or 9, I'm in the hospital, so doing my normal work till 4. At 4 p.m., I'm a teacher going to the university, teach students till 7, and then at 7, doing my private clinic. This private clinic can finish at midnight, but these private clinics are very important because this is the main source of who can finance all the ASCOVIM activities, because we don't have permanent support. We have spontaneous support, but not permanent support. I'm a man who knows that this is what God asked me to do, and this is what I'm doing. I'm so happy.